Trauma, in its simplest form, refers to a deeply distressing or disturbing experience. Its origins can be traced to the Greek word for trauma, meaning wound. Initially used in medical context to describe physical injuries, the term has evolved to encompass psychological and emotional wounds. Today, trauma is understood not merely as an event, but as the lasting impact of such events on an individual's mental, emotional, and physical well-being. This evolution in understanding reflects centuries of inquiry into human suffering and resilience. Welcome back to Student of the Brain, or if this is your first time visiting, welcome. My goal is to provide honest discussion on a range of topics related to psychology, the human brain, human behavior, and all things in between. Although I'm not a doctor, I try my best to provide accurate information, and I've provided references below. Please enjoy the vid. Leave a comment, like, subscribe, and share. Let's get started. Psychological trauma arises when an individual experiences an event or a series of events that overwhelm their ability to cope, threatening their sense of safety, stability, or identity. Such experiences can disrupt normal functioning, leading to a range of emotional, cognitive, and psychological responses. To understand the causes of trauma, its various forms, and its effects on the human psyche, it is essential to explore its historical and psychological roots, the biological underpinnings of the brain's response to trauma, and the social and individual factors that influence recovery. Trauma has always been a part of the human condition, yet its recognition and understanding have varied across cultures. In ancient Greece, soldiers returning from battle often displayed behaviors that we might now identify as symptoms of post-traumatic stress disorder, or PTSD. These included vivid flashbacks, heightened arousal, and emotional withdrawal. While these symptoms were not understood in the psychological sense, they were often attributed to divine intervention or moral failing. The Iliad of Homer offers one of the earliest literary portrayals of trauma. The grief and rage experienced by Achilles following the death of Patroclus illustrate the profound psychological impact of loss and violence. Similarly, ancient Roman accounts describe gladiators who exhibited signs of chronic stress and emotional numbness after years of life and death combat. In both cases, trauma was acknowledged, but its psychological dimensions remain unexplored. The modern study of trauma began in the 19th century, when figures like Sigmund Freud examined hysteria in women, linking their symptoms to repressed memories of traumatic events. During the World Wars, shell shock became a common diagnosis among soldiers, marking a significant step toward understanding trauma as a psychological phenomenon. This term was later replaced by combat stress reaction, and eventually PTSD, reflecting an evolving understanding of trauma as not merely a wartime phenomenon, but a condition that can affect anyone exposed to overwhelming stress. Trauma arises from events or circumstances that overwhelm an individual's ability to cope. These events often involve a threat to life, bodily integrity, or personal safety, though trauma can also stem from experiences that shatter one's sense of self or stability. The causes of trauma can be categorized into three main types: acute, chronic, and complex. Acute trauma results from a single, highly distressing event, such as a car accident, physical assault, or natural disaster. For example, ancient accounts of natural catastrophes such as the eruption of Mount Vesuvius in 79 AD describe survivors grappling with intense fear, grief, and disorientation. Chronic trauma develops from prolonged exposure to stressful or harmful conditions, such as ongoing domestic abuse, living in a war zone, or systemic oppression. Enslaved individuals throughout history, including those in ancient Rome and the transatlantic slave trade, endured chronic trauma that not only affected their immediate well-being, but also left a legacy of intergenerational trauma in their descendants. Complex trauma arises from repeated and prolonged exposure to traumatic events, often of an interpersonal nature, such as childhood abuse or neglect. Ancient texts and mythologies are replete with stories of individuals who endured complex trauma. For instance, the tragic figure of Oedipus in Greek mythology can be seen as an archetype of someone whose life is shaped by layers of familial betrayal and personal suffering. Trauma and psychology are deeply interconnected, as trauma fundamentally alters how individuals perceive themselves, others, and the world. Sigmund Freud was among the first to conceptualize trauma in psychological terms. He described it as an overwhelming experience that the mind attempts to repress, often resulting in neurotic symptoms. His studies on hysterical patients highlighted the connection between unresolved trauma and physical symptoms, laying the groundwork for modern trauma theory. The advent of neuroscience has further illuminated the relationship between trauma and the brain. Trauma disrupts normal psychological functioning by interfering with memory consolidation, emotion regulation, and stress response mechanisms. It often leads to conditions like PTSD, which is characterized by intrusive memories, hypervigilance, emotional numbness, and avoidance behavior. Diagnosing trauma-related conditions poses significant challenges. One primary difficulty lies in the subjective nature of trauma. What one individual perceives as traumatic may not be experienced the same way by another. This variability complicates the clinical assessment of trauma, as there are no universal criteria for what constitutes a traumatic event. Additionally, trauma-related symptoms often overlap with those of other mental disorders, such as depression, anxiety, and substance abuse disorders. This comorbidity can obscure the root cause of a patient's distress, leading to misdiagnosis or incomplete treatment. Expressions of trauma can vary widely across cultures, influenced by societal norms, religious beliefs, and linguistic constructs. For instance, some cultures may emphasize physical symptoms, such as pain or fatigue, as manifestations of psychological distress, while others may focus on emotional or spiritual disruptions. On a chemical level, trauma triggers the release of stress hormones like cortisol and adrenaline. While these hormones are adaptive in acute situations, chronic elevation can lead to long-term damage, affecting not only the brain but also the immune and cardiovascular system. Not all individuals respond to trauma in the same way. Factors such as genetic predisposition, early life experiences, personality traits, and social support play critical roles in determining how someone copes with trauma. Resilience, the ability to recover and adapt in the face of adversity, varies widely among individuals. Some people exhibit what is known as post-traumatic growth, finding meaning or strength in their experience of suffering. Others may struggle with chronic symptoms that hinder their ability to function. While the challenges of diagnosing and treating trauma remain significant, advancements in therapy and neuroscience offer hope for recovery. By recognizing the diverse ways in which trauma manifests and affects individuals, we can create more effective interventions and foster resilience in the face of adversity. Feel free to leave a comment below and share your thoughts. Thanks for watching. If you enjoy these types of vids, like, subscribe, and share to help grow my channel. Stay strong and healthy. Much love.